It is Black Maternal Health Week, and we are shining a light on the disproportionate number of Black women who die of pregnancy-related causes in the United States. For every 100,000 live births in 2023, about 50 Black women died. That's up slightly from the year before and far higher compared to women of other races. In fact, Black women are 3 times more likely to die from childbirth complications compared to white women. That is according to the CDC. Joining us now is physician and health equity advocate, Dr. Bayo Curry-Winchell. Dr. Bayo, thank you so much for being here. I mean, it's shocking, but we talk about this a lot, and this seems like one of those things that people know is a problem in the United States, but we're all still surprised that it's still such a big problem. Break down these numbers for us, because I was reading the CDC says about 80% of deaths related to pregnancy in the United States across the board are totally preventable. Why is this still such an issue?
Exactly. It's completely preventable. So there's multiple reasons why. We have to think of structural racism, implicit bias, and gaps in healthcare continue to impact women across the country, but especially Black women year after year.
When you talk to patients who have experienced concerning interactions, maybe inside a doctor's office, what do they say they notice? And what do you hear from Black women compared to, say, a white woman about their experiences with doctors compared to their white counterparts?
They share that they haven't been seen, they haven't been heard, that their complaints are often dismissed and ignored. And this is happening whether it's right at the time when they get pregnant, during delivery, or after. And that's why we see these outcomes, really poor outcomes affecting Black women.
I understand you have a series of questions you like to ask your patients. What are those, and how could people who aren't seeing you or maybe live in a different state incorporate that into the way they go to attend doctor's appointments?
I call them the 3 C's. They're easy tools to advocate for yourself. So it's about being clear, concise, and confident. All of us have had the experience where you go and see your doctor and all of a sudden you feel intimidated and anxious. And you're like, I was here and I was going to ask several questions. And what just happened? Well, if you can go into that office being clear about your symptoms. So instead of saying, I don't feel well, instead saying, I haven't felt well for 3 days and I have stomach pain and it's impacting my quality of life. The more details you can give, the more your doctor can help you. Also being concise. All of us have experienced the dreaded 15 minutes. You might be lucky to get extra 5 minutes. Yeah. So if you can lead with your most pressing questions right from the get-go and say, these are the things I'm worried about. And then last, be confident. You know your body best. And so honor that and recognize it and share. These are the things that I'm concerned about. So leaning into those 3 C's, plus if you create your own playbook, that's a wonderful way to be able to advocate for yourself each time you see your doctor.
Why do you think it is so important to be your own advocate in these situations? A lot of people say, well, just fix the system. But obviously the system hasn't been fixed. So why is it so important that people actually really speak up for themselves?
Unfortunately, our healthcare system is broken. And so when you talk about your care, especially when you're right in that doctor's office, your health is your most prized possession. So you need to be able to find tools that you can advocate for yourself. Because in that moment, the only thing that you're trying to do is get the best care possible. So I say to those who are like, why should this matter? You all know someone who has been vulnerable in a situation and hasn't been able to get the care that they deserve. Because in the end, it can mean the difference between life and death.
And do you think if everybody goes in and asks these questions, and we only have about 10 seconds left, it helps kind of further a standard of maybe doctors just thinking they should be paying attention to this quicker?
I do, and I live in it. I, as a Black woman, almost passed away giving birth. So these are C's that I believe in and I know help save my life.
Dr. Bayo, thank you so much. We appreciate it.